Okay, this is my IV piggy bag. First, I would compare my MAR to my doctor's order. I would check the patient's name, the type of medication, the name of medication, the dose, the time, and the route. I would check for any allergies on the patient. I would compare the medication itself to the MAR and the doctor's orders. In the nurse's station, I will check my IV book and make sure everything is compatible. I will check if it's a safe dose, and it is. Zantac 60 milligrams. I do not need to dilute it. Let's see. It is compatible with my dextrose, so I don't have to do anything there. I will give it over 15 to 20 minutes. I will check any precautions, anything I need to monitor. I will use antacids to relieve pain with my Zantac. I will check if they have any relief of symptoms, which would be their GI pain, their GERD. I will try to get them managed on my oral dosage. I will monitor vital signs frequently and their pain levels, obtain their baseline SCR. I would monitor that during the treatment. I would monitor ALT if therapy exceeds 400 milligrams for 5 days. I would change oral dose when appropriate. I will tell my patient to try to stop smoking, or at least avoid smoking while they're on the Zantac. Alright. And I would just look at any side effects, their abdominal discomfort, watch their burning and itching at IV site. Just really check on them and make sure that it's doing what it needs to be doing and that we don't have any other side effects that occur. Alright, well, I'm done with that, so I'm ready to prepare my medication. I will wash my hands. I have my medication labeled by hospital protocol. My Zantac 60 milligrams. I'm giving it 50 drops a minute. I'll have my name, the date, the time, the patient's name, the patient room number, like I said, whatever the hospital, is protocol for me to put on there. I have my solution, my tubing, my prep pads. If it's an INT, I'll wear gloves. Alright. I would check my bag for any cracks. I would check for any discoloration. I would check the expiration date. I would check for any solids in it. I'll just make sure it's clear. Alright. And I'll also, when I'm looking in my book, I will check any medication this patient is taking, make sure that it is compatible. If they're taking warfarin, I would need to pay attention to their PT and INR blood levels. So I need to make sure that that's clear there. Alright. Make sure my tubing's closed off. Check my tubing for any problems. And this is sterile. Gotta make sure there's no bubbles. And if this top touches anything, then I would need to get some more tubing.
Cover nothing.
I'm very careful not to waste any.
Okay.
Alright, now I have that. I would put my top back on that. Just pretend I didn't throw that away. Because I do need to keep it sterile. I'm ready to bring my supplies in my patient's room. My prep pads, and my saline. Alright, so now we're ready. So when I come to my patient's room, I'm going to check for blood return. Before I check for blood return, I would wash my hands. Set this down. I would my hands right as I come into the patient's room. I would identify them with 2 patient identifiers, check their ID band, ask them their name and date of birth, ask them their allergies, explain why I'm doing this. I'm giving them Zantac 60 milligrams. The doctor has ordered that for their GERD and their abdominal pain. Let's see. Ask them for their allergies. This patient does not have an IV, so I do not have to wear gloves, but I will check for patency of the IV line. I'm going to clean the port closest to the patient. Okay. And if the top of this touched anything besides the port, I would get another one. Depending on hospital protocol, you can flush a little or a lot. Make sure there's no bubbles. Alright, I'm done with that. And I would dispose of that per hospital protocol. Keep that sterile. Alright, I'm ready to hang. And I would check my IV site as it is for any redness, burning, infiltration. If I have any problems with the main site, I would need to reinstate another IV or tell the doctor. Check for blood return. And I'd make sure this is compatible, and it is with my medication. Make sure that that's shut off. And it is compatible, so I don't have to do anything extra there. And I will insert this in the port close to the IV bag. If it did pop out and hit, I will get another one. More tubing. Alright. Now open this all the way. I'm on control with this one. Make sure there's no kinks. Alright. I'm doing 50 drops a minute, so I would do 25 drops every 30 seconds, and then I'll count for a full minute. Count for a full minute. Forty-three, 44, 45, 46, 47, 48, 49, 50. Okay. So now that that's all set, I would stay with the patient, make sure it's going through okay, no infiltration, no pain. I'll ask them if they have any burning sensations. I will reevaluate their pain level to see if this was effective when it's over. When I come back in the room, I will wash my hands again. I will clamp this off. Clamp this off. I will discontinue it this way. I will dispose per hospital protocol. And some hospitals require you to flush afterwards, so I would flush if needed, especially, but this is compatible, so I will only flush if the hospital requires it. So I will raise my bag back up, put to my IV flow rate the way it was, or the way the doctor requested it to be. And I will check on my patient, ask if they feel any pain, check their pain level, leave them safe, bed rails up, bed locked, call Bill and reach, and I would perform the piggyback whenever, you know, if it's Q12 hours, I'll do another 12 hours, whatever the order says. And that is my IV piggyback. And then I would document the medication name, the time, the route, the patient, the dose, and how the patient received it. And that is my piggyback.